Okay, so I have said this before and I'm going to say it again. Please, the right timing for booking of your pregnancy is 12 weeks. So what this actually means is that is a time that we request for some laboratory investigations, and after which we look at them and we review and let you know, okay? But the time you should come to the hospital is once you miss your period, you should come for testing, all right? Because most of the time the pregnancy has occurred before missing your period. So by the time you are missing your period, it may be around 5 weeks, or plus. And once you do that, it's important that you come for testing. First of all is to know if you are indeed pregnant, because there are so many causes of what we call cessation of menses. Okay, so once we are able to detect that you are pregnant, the next thing is for us to have an ultrasound scan. So the ultrasound scan is important because we want to essentially localize the pregnancy. We localize it. Where is this pregnancy? Is it inside the womb or is it outside the womb? You must have heard of what we call ectopic gestation. That is where pregnancy, the fetus, the baby, is not inside the womb but outside. A reasonable percentage of cases, if it is outside the womb, may be in the tubes. Now look at what's going to happen. Now this is the catch. When you delay coming to the hospital when you are pregnant, you don't have an ultrasound scan done, you are waiting till 12 weeks before all those things are done. If it is an ectopic pregnancy, this pregnancy, especially like I said, majority are in the tubes, can rupture. If it ruptures, the woman can bleed so much because the blood supply to the fallopian tubes called all the way from the aorta. Aorta is quite big, almost the size of this my fist, and when blood is coming from there to supply the fallopian tubes, it can lead to a lot of bleeding. So we encourage early clinics so that you don't have to wait. Sometimes people wait till 14 weeks, 15, 16 before coming to the hospital, so please, it is important. And usually when this ultrasound for localization of pregnancy is done, majority we might have to go through the vagina because at that point it might be difficult to appreciate leaf coming from the abdomen. So if we are having an early scan, let's say around 5 weeks, and the sonographer is, takes your consent, or that he wants to go through it, please understand it, because to see better. Otherwise, it should be trans-abdominal, that is following on top of your abdomen. That is when the ultrasound. So the highlight in this discussion is, first of all, is the timing to come to the hospital. Please don't allow anybody to tell you that you should come around 12. That's wrong. All right. Before we used to say following second miss period. Why we used to say that is because by then it should be around, say, 8 weeks, and we are sure. But because of this ectopic, we might rather fine-tune that discussion and say rather come once you miss your period. It's okay if we tell you that you are not pregnant. Thank you. See you in the next episode. I remain Dr. Ibodike, obstetrician and gynecologist consultant.